Okay, hello and welcome to the Cancer Caring Center's Cognitive Toolbox. I'm Jennifer Kem and I'd like to introduce you to Marissa, who is going to talk a little bit about word recall and some other challenges that we have with cognition. So I'll switch over to you.
All right. Hi, everyone. Can everyone see this okay? Is it sharing? Okay. Awesome. So good evening, everyone, and welcome to our presentation tonight. Before I begin, I just have to kind of say on behalf of the Centers for Rehab Services that this presentation is not intended as any formal diagnostic or any treatment for the condition that we're going to discuss. But if you do have any symptoms related to the content or of the presentation or any of the conditions, please feel free to consult your medical professional as well as myself, and I can help kind of guide you in the right direction, which we can try to talk about a little bit later as well. So as Jen mentioned, my name is Marissa, and I'm the speech language pathologist for the Centers for Rehab Services, and primarily work out of the Cranberry area at the Lemieux Sports Complex. If you've attended presentations in the past few months, you'll notice that we've discussed word finding a few times. However, this is often a topic that is, asked about a lot, and it's backed by popular demand today. This time I plan to go a little more in depth, however, about word finding following treatment and cancer diagnosis. So one of the things while I was doing a little bit of extra research for this presentation that I found that there's actually some literature that can suggest that, now this is a wide range, but 17 to 75% of women experience cognitive deficits ranging from starting at 6 months to 20 years after chemotherapy. Now, like I said, there's huge variability with this number, but it goes to show that there's a very strong connection and correlation between chemotherapy and cognitive changes. The things that you're experiencing, feeling, or you may experience, feel, or kind of questioning about some changes you might be wondering if it's going on or not, or possibly as a result of cancer, the treatments that you received as a result. There are any number of things. As we go through this presentation, I want to encourage you to try to relate some of the topics back to your own experiences, just to kind of help with understanding how and why your mind is maybe changing, or just why certain things have happened. And that'll also help, as Jen mentioned at the end, we'll have kind of a question answer, and oftentimes this kind of just turns into a discussion, but I think it's helpful to think about these similar experiences as we're going through to kind of drive that conversation. Although the focus, of today will be trying to dig deeper into word finding itself, it's very important for us, and I illustrated this last time as well, to also review that there are cognitive changes that have an impact on our word finding and our language. Namely, we'll be discussing briefly memory, attention, and executive functioning, and how all of these relate to word finding. Another common change that can occur during and following treatment is called brain fog, but we'll be diving into all of these topics later on in our discussion. Okay, so what is brain fog? Brain fog, as some of you may call it, or chemo brain, can be caused both by the chemotherapy, the different types of treatments that one might have to go through as a result of cancer, or the cancer itself, especially if there's an origin of a tumor in the brain, or if the cancer metastasizes to the brain. There are a lot of other factors, such as secondary medications that we might take because of pain or mood changes that can cause this brain fog or chemo brain, and can occur during or following completion of the treatment. To discuss a little bit more in depth, complications can vary and can present very differently from one person to another, also depending on locations that are affected in the brain. Someone whose cancer affects their central nervous system, for example, may have similar presentation to someone we might see with a focal brain injury. And when I mean focal brain injury, I'm referring to an injury to a specific part of the brain. And different parts of the brain yield different impairments based on the location. When the right hemisphere is affected, we might see and experience deficits with our nonverbal or our pragmatic communication, our body language, our gestures, socially, whether we're socially appropriate, things like that. We might experience a left-sided neglect, some visual constructional impairments, and some speech pattern changes. All of these areas are housed in the right hemisphere of our brain. Conversely, we have the left hemisphere. With the left hemisphere, this is where a lot of our language symptoms might occur, changes in attention, our verbal reasoning, again, memory, and we might experience the opposite as far as a right hemiparesis. Additional factors that I've mentioned here can also have long-term or temporary effects on our thinking and cognitive skills, depending on management. Hypertension or hypotension can impact our ability to focus, retain information, and think. So proper monitoring is often important when it comes to having any blood pressure issues. As I also mentioned with the brain fog, modifications to medications can improve or conversely affect our mental clarity and focus, thus improving or making recall harder or more difficult. Sleep is very important. It's important for everybody, but especially when it comes to having a healthy brain, it's important. If you don't have enough sleep, you can wake up tired and fatigued, which can affect your attention, it can affect your focus, and just some general rules of thumb that we usually recommend as speech language pathologists is, trying to have a sleep routine. Go to bed around the same time, wake up around the same time, aim for that 7 to 9 hours. Try to eliminate any blue light emitting devices or things that are going to keep your brain stimulated about an hour before bed to kind of help the mind wind down. Health and hydration are also very important, and hormonal changes can also have an effect on our thinking. Stress, mood, emotional changes can exacerbate our cognitive symptoms. So it's important to incorporate self-care, and that looks different for everybody. Some people prefer mindfulness. Sometimes self-care is exercise. Sometimes self-care is reading or just kind of taking a few minutes to just do something that you want for yourself. But it's important to find what's right for you, find what's important, and kind of stick with that. And most importantly, above all, talk to your doctor, talk to your physicians, talk to your family, and just make sure you're doing your own research that can help with providing solutions. So something that we did not discuss during the last presentation was the overall anatomy of our brain. While this illustration is kind of simplified, I think it gives a really good overall impression of where cognitive and language centers, of our brain lie, depending again on the area of the brain that's affected. If it's affected specifically by a certain site of lesion, it will determine some of the complications that we may experience. So for the purpose of our presentation today, most of the areas of concern that we would have would be our Broca's area, which you can see is kind of a lighter purple area kind of in the frontal lobe of the brain. Our Wernicke's area, which is the yellow spot within the green section of the brain. And just overall, our temporal lobe really houses a lot of our language and our memory. And the parietal lobe also has some responsibility in this as well. So if we go to the left side of the screen, you can see the fourth down is Broca's area, which is our speech control. Right below that, we have our temporal lobe, which it controls our hearing, language, and memory. On the right side of the screen, we have the Wernicke's area, you can see is pointed to, which is our language and our comprehension. Okay. Not to dig deeper, but trying to keep it brief into our cognitive impairments and their effects on our word finding. So difficulty with memory and recall can impact our ability to recall specific names, places, objects, and things of that sort into conversation without language centers themselves even being affected. Processing is something which might also be delayed, which we actually will talk about a little bit more, I think, in the next slide or two. We might experience difficulty with focus or being distracted, which affects our ability to maintain a conversation, stay within a conversation, and just kind of focus. And it might be difficult to maintain our own thoughts or sequence a conversation. So first, we have what we call executive functioning, which really includes just a whole variety of skills that we really use in day-to-day life. You just might not have heard of this term before. One of the things that is housed in the executive functioning umbrella is called our working memory. So this is our ability to hold, process, and encode or interpret information to help to temporarily store it. An example of our working memory is our ability to store a password or a temporary code, maybe to unlock something that you might get through your email or through your phone, and just our ability to temporarily store that code or that password in order to insert it into a different type of device. Another aspect under executive functioning is called our initiation. So it may be difficult to initiate an activity on one's own without any prompting. And in regards to language and communication, this can affect our ability to maybe initiate a conversation with someone without them prompting with questions or comments or having any external influence. Sequencing and planning can be affected. This is our ability to identify an overall goal and sequence steps in order to achieve that goal. For example, planning a party. Sequencing and planning often can affect our ability to identify what we're planning, sequence and manage our time in order to maybe order things ahead of time, plan out our food, our games, our invitations, anything like that appropriately. We have our concentration or sustained attention, which we will talk about in a future slide. And then our ability to shift and solve problems. So this is our ability to recognize a problem and provide solutions. So for example, if presented with a problem, are we able to identify it as a problem? For example, grabbing an item on a tall shelf. What is the problem? It's trying to grab the item on the tall shelf. What are some appropriate solutions? Ask somebody for help. If balance is okay, use a step stool or a ladder, things like that. This is our ability to shift and to solve problems. And last, under this executive functioning umbrella, we have self-awareness. So this is our ability to be aware of strengths, weaknesses, and evaluate possible barriers for future performance. This can be very helpful, actually, even as a cognitive strategy. I a lot of times will, and I don't remember if I mentioned this in a prior presentation, but a lot of times I'll talk about with my own clients what we call metacognitive awareness. And this is simply thinking about your thinking. So having an idea of self-awareness can help us to incorporate strategies effectively where we need to, or identify potential communication barriers or cognitive issues that might arise in a situation. When we have that sense of awareness, then we can kind of plan a little bit better. Like I said, incorporate strategies and overall try to improve our efficiency or our accuracy. Next, we have memory. Memory, as I've mentioned a few times, can definitely affect our word finding. First, we have our immediate or our working memory. So this is information that we're obtaining through all of our senses, our sight, our hearing, our taste, our smell. And when it's stored for a brief, this is just stored for a brief period of time or seconds. Again, going back to the example of temporarily recalling a password or passcode, as we talked about with executive functioning. Next, we have our short-term or our recent memory. This information is just kind of within the realm of minutes, hours, days, and really is just stored long enough to be used. We have our long-term or our remote memory. These are things, our ability to recall things that have happened in the past, or we call them episodes. This type of memory is usually pretty preserved after some type of trauma or injury to the brain. And you know, it is stored in different parts of the brain than our short term, but like I said, it's usually pretty preserved unless something is kind of surrounded by trauma. So this is our ability to recall maybe a trip we went on when we were a child, remember our long-term friends and things like that. Next, we have our procedural memory, which is our ability to remember things in the future. So, perspective memory. This is our ability to remember things in the future, recalling our upcoming appointments for the week or adding appointments based on recall of other things that we know that we have going on upcoming. Our ability to recall pictures or images is called our visual or our spatial memory. This is one of my favorite examples, but you know, thinking about the idea of walking into a room and not remembering why. I'm pretty sure I do that about 5 times a day. So, you know, I think that's a pretty common phenomenon, but, you know, sometimes to help kind of get yourself back on track, you might use this visual or the spatial memory and try to visualize where you were when a thought popped in your mind that prompted you to walk into another room. So kind of visualizing or retracing your steps can also be helpful. Next, we have our motor memory, which is remembering motor skills related to maybe work. For example, knowing how to grab something on your desk without even looking at it, or trying to type while looking, or relating to recreation, just jumping back on a bike and getting back to riding a bike again. We have our procedural memory, which is our ability to process a procedure. For example, how to cook your favorite recipe, or just anything that's a typical procedure or routine. Again, in my experience with clients, this type of memory is a little bit more preserved because these are things that they're automatic. That we have a procedure for them, our brain kind of goes into this automatic mode. And this last part of memory is very important for word finding and for language. But we have our verbal or our auditory memory or semantic memory. And this is remembering using words or language, for example, to tell a story. Next, we have attention. So there are 4 main significant types of attention that we'll talk about briefly. First, we have our sustained attention, which is your ability to concentrate for long periods of time. Hopefully, you're sustaining your attention to listen to this lecture today. We have our selective attention, which is our ability to drown out background noise, to focus on specific topics or different parts of your environment. Again, listening to this lecture, maybe while you're receiving a text message, your phone's ringing, someone might be making dinner in the background. This is your ability to drown that out while trying to focus on what we're doing here. Divided attention is our ability to pay attention to 2 or more things at one time. However, it's really important to reinforce that our brains aren't really meant to multitask. So while at one point it might have been easier to manage many things at one time, especially, you know, multitasking at work, or if you have kids trying to manage different schedules and those kind of things, we weren't giving 100% effort to all of those things at one time. So as our brains change and cognition comes a little bit more to the forefront, it is more difficult to attend to multiple things. And this can definitely have a connection to our word finding if distracted. And finally, we have our processing, which I said earlier we would touch base with a little bit further on in the lecture today. But our processing is our ability and our speed to process information that we're hearing and information that we're seeing. So when it comes to language, this is sometimes one of the biggest factors that can affect our communication. If, for example, if someone is giving multiple directions at a time, it may be hard to recall the second or third step in the direction because it's taking us longer to think about even the first step. If it's taking longer to think about the first step, then we're missing the rest of the information in the conversation. All right, so this is kind of the main, the bulk of our presentation today is language and word finding. But like I've said, it's really important to really consider all the other areas of cognition, because sometimes it truly is that our attention is being affected, which affects our ability to come up with words. Or, we might actually forget specific names, places, things like that, which affects our communication, our ability to come up with words. But our word finding itself can be affected. So language, by definition, from the Merriam-Webster dictionary, includes the words, their pronunciation, and the methods of combining them used and understood by a community. It's a form or manner of verbal expression, and it kind of encompasses the vocabulary and the phraseology belonging to an art or a department of knowledge. Simply put, language is the way in which we communicate. It involves verbal language, nonverbal language, so talks, like physically speaking, nonverbal, back to our body language, our gestures, things like that. It can affect our writing and our typing, as well as our ability to read and to understand clearly. Word finding difficulty is normal, but with a brain dysfunction, it can be more frequent or more severe. And whether we actively intend to or not, we're always communicating in some way with those around us. Okay, so what do we do next? So we've identified maybe that we have some different language or word finding impairments or cognitive. So what does that mean? What are the next steps? So one of the purposes of these presentations and the Centers for Rehab Services involvement, as well as reaching out to a lot of the doctors, is to help prevent, falling through the cracks, because we know that this happens and we know that people are experiencing these changes, but at the same time don't really know where to go or what to do. So first and foremost, visit with your doctors. And I know, for the most part, we should have regular follow-ups, but don't be afraid to share your concerns and discuss all of your symptoms. Give information about your medications. If you have a hard time remembering things to bring up at your appointments, I know I do. Write down your questions so that you know that you're hitting on all of the areas of concern. Sometimes when we go to appointments, the medical side is at the forefront, which is very important. But because of that, we might forget to bring up memory, to bring up word finding and all of our concerns. So like I said, make sure you discuss all of your symptoms because it can be very multifactorial, going back to sleep, medications, health, hydration, all of those factors. So discussing concerns with your physician, attending lectures, participating in support groups, and finding resources is really important for getting you in the direction and getting you the help and care that you need. One of the pieces of that puzzle is speech, language, and cognitive therapy. I think sometimes the term speech language pathologist can be a little bit misleading because we do address voice, we address speech, we address language and word finding, cognition, and actually swallowing too, which I didn't put all of those on there for the purpose of today's presentation, but that talking with your doctor can kind of open up the idea of consulting a speech language pathologist to help. So our goal is to help provide you with exercises and with strategies to help improve these deficits. I don't remember if I mentioned this in any later slides, but I know for myself, I like to focus a lot on function with my clients. So I like to ask, how is this affecting you? How is this affecting day to day? Let's work on it. Let's find the strategies. Let's find the tools that are going to help you. So that's kind of the main idea of speech, language, and cognitive therapy. So everyone has some degree of word finding difficulty, but what differs sometimes following a cancer diagnosis and the treatment is the frequency in which this occurs. So things that we might have once shrugged off before might become more frequent, might be harder to self-correct, kind of harder to get yourself back on track. For most of us, this type of situation is infrequent. We might laugh it off, but then later recall a word. It might just pop up when we're not thinking about it. According to a workbook that I use often in therapy, which I'll discuss briefly later, Tomlin has stated that for a person who has a brain dysfunction, the frequency of anomics or word finding difficulties is increased, and the recall of a word is often non-existent. This can lead to emotional changes as well, which can often exacerbate impairments. So what that basically means is, word finding is seen across a lot of different diagnoses relating to cognitive dysfunction. Brain dysfunction. So strokes, brain injuries, concussions, cancer. So basically what that's saying is, we do have an increased chance of having difficulties with these types of diagnoses. As far as the emotional component, I know this is something that my own clients will experience very often, but being stuck on a word, having trouble coming up with a word can become very frustrating. And that kind of sends us into almost a snowball effect of having more trouble with communication and coming up with words just because we're getting further away from what we want, just because we're frustrated or anxious or sad. So some of the areas that we might need to address in relation to word finding are as follows on this slide. So one of the areas we might need to address is answering questions. Answering questions might be difficult because it often requires a very specific answer. And if that content isn't stored in our memory, then it's going to be hard to even come up with that answer. So when I say specific, the idea is called our convergent deduction or a convergent word finding. So the use of closed-ended questions is often a communication strategy to help with improving word finding or responses for specific names and questions. And again, we'll talk about some strategies later, but instead of asking open-ended questions, sometimes one might find it helpful to give choices or rephrase a question in the way that helps facilitate a response that someone might be able to easily retrieve. Next, we have building our categorizational skills. Our brains are highly organized organs, and I often compare them to filing cabinets. When information isn't organized, so to speak, in our brain, it might affect our ability to correctly find words. So by improving our ability to organize this information in a logical manner, this can help us to code or to retrieve words as we need to. Using word relationships can be very important. Thinking about the associations or relationships between words themselves help to improve word retrieval. We can also, I'm not sure if this is on here next or not, but we can also think of their opposites. You know, that's still a relationship. Even if we're not thinking of the same word or something similar, thinking of the opposite can also be an effective tool and cognitive skill. Use of word finding strategies is always important and will be discussed in upcoming slides, but using these strategies aids in our ability to effectively, as a speaker and as a listener, to communicate. I always say it takes two people to communicate, so at least two people to communicate. So it's not always just on us. When we're listening, when other people are listening, you know, there are things that we can all do to help each other. And then the last part here, we have naming and selecting pictures. So this can be difficult if someone says, what's this? What's this? What's this? Also kind of going back to the answering questions, because there's only one answer. So when you can only come up with one answer and that's stuck or not organized, that affects our word retrieval. But sometimes giving more context, an initial letter, sounds, things like that can help to improve the naming in that situation. Now on to some strategies. So I tried to add a few more in here from the last time, and I might have modified them a little bit, but you know, I still kind of kept it separate from strategies from the speaker and strategies as the listener. As mentioned, you know, it takes two people to communicate. So sometimes the listener needs to be the one to implement the strategy, and other times it might be us as the speaker. And I always like to reinforce as well that it is okay to use strategies. In fact, sometimes strategies actually improve our word finding or our encoding of information to be stored later in the future. So the primary goal for using these is to communicate. It might help us come up with the word, or at least we'll let our communication partner know what we're talking about and what we're trying to say. So to start with strategies for the speaker, I think this is a bigger area of concern for the things that maybe people on the call are experiencing. So coming up with the words themselves and communicating. Substituting words can be one of the most effective things you can do. Kind of going back to that idea of the word association and using synonyms, using a similar word that doesn't change what you're trying to say can be very effective. For example, if you want to say German Shepherd when talking to somebody about their pet, but you can't recall that word retrieval isn't there, you can easily substitute dog and it doesn't change what you're trying to say. Now you couldn't substitute cat or golden retriever because that would change the meaning. But you know, simplifying it and just saying dog, pet, something like that still enables one to communicate despite that word finding difficulty. Conversely, naming the opposite can also be helpful. So for example, if you're trying to think of the word notebook in reference to maybe like an iPad or something like that, you might say, oh, not my phone, not my computer. Oh, it's my iPad. So thinking about the opposite can help. Probably one of my favorite word finding strategies is called circumlocution. So describe it. Using circumlocution, we can describe or talk around the words that we want to say. Think about what's it look like, the target, whatever your word you're stuck on. What's it look like? What's it taste like? Where do you find it? What category is it? Is it a tool? Is it a food? Is it something you use for recreation? Give as many details as you can. Like many other strategies, this can help you generate the word, but this also builds semantic or meaning behind the words, helping us to encode for a later time. So let's use the example again of a computer. Let's say I'm talking about my computer or my laptop and I can't get that word out. I might say, oh, it's that thing, it has a keyboard. I use it to send my emails and to search the internet. My son or daughter types their papers on it. It's in my office. Oh, that's it. It's the computer. So again, that helped me to come up with the word, but also helps to build a relationship between that word and our brain to use it another time. Other types of communication like body language, gestures, pointing, and drawing can be helpful. It can also be helpful to visualize or form a mental picture in your mind about something to help you. And then one strategy which can be used as a clue or a cue for yourself is to think about the first letter or the first sound of a word. So you might not have that automatic retrieval of the word itself right away, but you know that it starts with a certain letter. So, for example, trying to think about maybe someone and where they live. Oh, I went to visit her. Now she lives in, what's the name of that city? ABC, Cincinnati. That's it. That she moved to Cincinnati. That can be a very effective strategy. Oops, sorry. Now as the listener, it's important to make sure that the environment that we have for communication facilitates good communication. First and foremost, we have to make sure that both of us are paying attention. Communication doesn't go well when one person's paying attention and the other one's not. And it's also hard to remember things that we're not paying attention to, know how to respond when we're not paying attention. Limiting extra noise and distractions can be helpful, and give ourselves extra time to communicate, whether that be, a family member as the listener giving you time to come up with a word or to express yourself, or just giving yourself some grace if you're the one that's talking and giving yourself that time to come up with the word. Try not to assume if you're a family member or a loved one or a caregiver that you know what someone's trying to say, and try not to interrupt or let them or not let them finish their sentence. I know it's hard sometimes, especially when you know what somebody wants to say, but a lot of times it can be very therapeutic to let somebody work through and try to use their strategies, use their tools to communicate effectively. If someone, and going back to our concept of answering questions that can be difficult, if someone's having more difficulty, ask yes/no questions, give choices, prompt for clues, for cues. And it's always important to speak slowly, especially when processing comes into play. Okay, so you may be asking yourself, I have some strategies, I know a little bit about language now and cognition. What can I do? What can I do at home? So yes, we can do therapy, right? We can do cognitive therapy, we can do language therapy, but what can I do around the house? So first and foremost, I'm a big advocate for strategies, using strategies to communicate. But you can practice naming items around the house, pick an object and describe it, and kind of with that, identify an object and try to describe it to somebody without naming it. For example, a remote control. It's something, it has buttons that you use to turn on the television, it changes the volume, it changes the channel, etc. And then that person has to guess. Whoever the clue giver is giving the clue, and then you have somebody else that's trying to guess. As again, this can also be a strategy. We can do some, we call it divergent naming. So give yourself a minute to come up with as many items as you can in a category, or pick a category and try to name 3 to 5 items in within that category. You can do things that are very concrete. Name 5 cities, 5 fruits, 5 vegetables, or name as many shiny things as you can in a minute, or as many hot things as you can in a minute. Again, all good word finding activities for home. You can find a picture in a book or a magazine and try to describe as many details as you can. Read the news, a book, magazine, have a conversation with someone about what you read. I didn't necessarily put this on here. I don't remember off the top of my head if I discussed this later, but I'm a big advocate for talking is the best therapy. So, be creative and have fun, set goals for yourself. I know it's hard right now with the pandemic, but it's nice that we have these opportunities even to pop on here once a month. And I know the Cancer Caring Center has a lot of other meetings going on, but this can be therapeutic in many ways. And so it's important to maintain socialization. When I say set goals, if it's hard to initiate communication with someone, maybe a goal would be to ask an employee a question next time you go to the store. Ask them where to find something. These are all things that can be very easily be done if you're, in that environment. So like I said, be creative, have fun. If you're talking, if you're using words, if you're communicating, it can be therapeutic. So I elaborated a little bit more on this as well from the last time. So before we discuss any of these things on this page, I really do want to reinforce, I do this all the time, even with my own clients, that you do not have to buy into a puzzle, a game, a workbook, an app, a program to improve. There's no research out there that says paying X amount of dollars a month for a cognitive program is going to get you X, Y, and Z results. Can it be a therapeutic? Sure, but there's no research that it proves any of that at this point. So doing stuff, I say free is fine. Do stuff on your own. Hopefully looking at these slides can give you some ideas of different things you might have at your house that you can already incorporate. So to kind of start with puzzles and games, things like word searches, crossword puzzles, Scrabble, bananagrams, categories, charades, heads up, catchphrase, apples to apples, headbands, Pictionary. These are all fairly common puzzles and games, but all have that language word finding basis to them, in addition to some other cognitive skills. So these can be very good. I'm anxious to hear some other people's ideas of things, but just kind of pulling from my repertoire, these are some of the things that I'll either incorporate into therapy or recommend that people do at home. Workbooks can be very helpful. I know sometimes, and this is something that we didn't talk as much about last time, but workbooks can be very helpful, especially if you're somebody who maybe doesn't have anybody at home during the day or certain times of day, and or you're just somebody that likes something that's structured. So I know I have had a patient that recently introduced me to these, it's called the Brain Games books. They have all different types of books out there. I did a search on Amazon and they have different themes, and but they have brain games for adults. And like one of the themes, I know if you like crime scene shows and stuff like that, there's a crime scene themed, that's a tongue twister, puzzle book that all relates to, different things like that. And they also have the answers with them. So you can refer to them for the clues or just to double check to make sure if you're correct or not. Two of the books that I a lot of times will use in therapy also can be accessed I believe just like on Amazon. But one of them is called Walk, or they're both called Walk, WALC. One of them is Walk for word finding, and that's number 8. And then another one is Walk 1 for aphasia. The aphasia one would probably be a little bit more, like I think the Walk 8 would be a little bit higher level of a workbook versus the aphasia one. It's a little bit more geared towards strokes. But still, you might find some good activities in there as well. I did add a few apps from the last time. Family Feud. It could be a fun app to still work on that word finding. Heads Up. I think I mentioned that on Puzzles and Games as well. There's an app called Clockwork Brain. There's not too much on there as far as language, but they do have a few higher level language tasks. Chain of Thought is an app that I like to use a lot. And once I introduce patients to it, they actually usually like it as well. Wordscapes, Word Ladder, Word-to-Word Association, 4 Picks 1 Word. These are all, I believe, free apps that I incorporate or that I have patients that really like. The next two on here, the Graphica and the Tactus. Tactus is the company. I guess so is Graphica, but they both have like free trials of a lot of their some of their apps. So their free trials are usually pretty limited. So I even personally tend to go towards more of the other apps and things like that. But they are options if that's something that you would like to explore. We got a little bit cut off here at the bottom. So then to kind of work into some different websites, I don't typically use too many websites as far as with therapy, but there are a few really good ones out there. This first one, memoryimprovementtips.com, has about 270 free games on there, cognitive games. And I kind of like apps and websites because it's same thing with the puzzles and the games. It's fun, you're interactive, and you don't really feel like you're working on improving language and memory and things like that. So these are some of my favorite games on the Memory Improvement Tips website. If you are an AARP member, I haven't been able to access their games in a while, but because I'm not a member, but if you're a member, they have free brain games that when I was able to last access them were excellent. They were some of my favorite games actually to use in therapy, but I haven't been able to access them in quite some time. But I believe that's just under their brain game section. Braincurls.com has some verbal ability games, as well as one specific one is called Wordfall. I'm going to probably say this wrong. Brangle.com has some different vocabulary building tasks. And then I'm sure you've heard of Lumosity. This is one of those ones that you've probably seen commercials for or heard commercials for that has an app as well. It is one of those ones that's a program, but they have free limited versions. Their limited versions are still nice though. They give you about 3 free games every day and they change them every day. You just can't pick from the whole catalog of games to pick what you want to do that day. They give you 3 free ones and that's kind of what's available. But I mean, to get 20 minutes of practice in, it's great. Okay, so I want to thank everybody for your time. I know some of this was repetitive, but I think we have a lot of new people on here, so hopefully that was still very helpful to hear kind of the basics when it comes to cognition and word finding. But I really want to thank everybody for joining and for giving me the time to speak today. I'm always available to chat. If you have any questions, you can always contact me. Like I said, I'm at the Lemieux Sports Complex in Cranberry, so I can either help with any questions that you might have, or get you, in the right direction if you are interested in therapy. So again, thank you very much. And we will go ahead, once Jen stops the recording, go into some questions and comments.